Hello everyone, my name is Dr. Shehzad Saeedullah and I am a head and neck and anterior skull based surgeon. Welcome to my YouTube channel where we take complex ideas and break them down into simplified forms for all the doctors to understand. So if that is of interest to you, please hit the like and subscribe button and hit the bell icon so that you get all the notifications from the page. So without further delay, let's get into today's video. So today we will be discussing the examination of the ear. I always tell this to my students that before beginning any examination, there are certain steps that they need to follow. First thing is introduction. Then you need to take consent. Then the patient should be properly exposed. Then comes your position and then comes your light source. So if you follow these 5 basic steps, you are never going to lose marks. So let us begin. अस्सलाम वालेकुम मेरा नाम डॉक्टर शहजाद सईदुल्लाह है और मैं यहाँ पे ईएनटी का माहिर डॉक्टर हूँ। आज मैं आपके कानों का मुआयना करूँगा। इस दौरान आपको कोई तकलीफ़ नहीं होगी। अगर आपको किसी किस्म की कोई तकलीफ़ हो तो आप मुझे बता सकते हैं। आपकी इजाज़त है? So I have introduced myself and I have also taken the consent. Now comes your exposure. So the ideal exposure in ENT, both of your shoulder blades should be visible, but in ear examination you don't need to do so. Then comes your position. In ENT, you should always be either on the right side of the patient or on the left side of the patient. And you need to be at the eye level of the patient. So right now, I think that I am slightly higher. So I'm going to adjust my seat so that I am in line with the patient. I should be 1 arm length away and I am sitting on the right side of the patient. And then comes a light source. For any examination, you need very good illumination. So the light source that we use in ENT is a headlight. So we put on the headlight, we adjust it and we turn it on and we focus it on the place that we want to examine. So the command in this patient is to examine the ears. So any examination begins with inspection. The first thing that we are going to do is inspect the pinna, which is a part of external ear. So how do you inspect the pinna? You will look at it from the front, looking for any swelling, any deformity, any redness that you can appreciate. Then you are going to flip it over and look at the posterior area and look at the mastoids. The same with this ear. You are going to look at the pinna, flip it over and have a look at the postauricular area and the mastoids. This is inspection. On inspection, you should also be noticing the size of the ears and whether they are in the normal position. So if you see here, the pinna should be in line with the second subunit of the face, and the size of the pinna should be equal to the second subunit. If the size of the pinna is more, you call this macrotia. If the size of the pinna is less than the second subunit, you call this microtia. And all of this information is helping you to see whether the patient may have any kind of syndrome, because in syndromic patients, you are going to see microtia or macrotia. So after the inspection of the pinna, now comes your palpation. While palpating the pinna, you are going to look at the facial expressions of the patient to see whether any of the areas is tender. And you also have to ask the patient that if it hurts somewhere on the pinna, that he should let you know. So let us start palpating the pinna, stabilizing the head. We are looking for any tenderness, any swelling, also looking at the preauricular lymph nodes, flipping it over, looking at the postauricular lymph nodes, and gently palpating the mastoids. After inspecting and palpating the pinna comes the examination of your external auditory canal. So in order to look inside the external auditory canal, you turn on the light source, you pull the pinna upward and backward, and with the thumb you pull the tragus slightly forward, and you have a clear view of what's inside the external auditory canal. This is examination without a speculum. After the examination without a speculum, you need to take an appropriate size ear speculum and you need to introduce it in the external auditory canal. And this movement should be a rotatory movement. You should be gently rotating it while seeing inside. And if there is any debris that you may find, you need to clean it out with a Jobson horn probe. So this goes gently in, and the same movement, you should be rotating the Jobson horn probe to clear out any debris that might be there. After that, you take the speculum out, and if there is a discharging ear, you should always smell the speculum. to see if there is any foul smelling discharge that may be present inside the ear. After examination with the speculum comes otoscopy. We take an otoscope. I always see my students struggling on holding an otoscope. Sometimes they are holding it like this, sometimes they are holding it like this. The correct way of holding it is you hold it like a pen, the same way that you hold a pen. You turn the light on, check whether the light is good enough for you to be able to see inside. You pull the pinna upward and backward and gently introduce it. And then you have a look inside at the tympanic membrane. The things that we are looking for is if there are any perforations on the surface of tympanic membrane, what is the color, is it dull or congested, if it is bulging or retracted, and we can also check for the mobility of the tympanic membrane. In order to do that, we ask the patient to do Valsalva while having an otoscope inside the ear. जी आप अपनी नाक इस तरह पकड़ें और जब मैं आपको कहूँ तो आपने मुंह फुलाना है, ठीक है, इस तरह आपने करना है, ठीक है. So we take the otoscope, we place it inside the ear looking at the tympanic membrane, and then we give command to the patient, जी आप मुंह फुलाएं. That's it. So in this way we can also see the function of eustachian tube, and we can also look for the mobility of the tympanic membrane. After examination of the tympanic membrane, the next step is hearing assessment. So in order to do hearing assessment, we will do the whisper test, and we are going to do the tuning fork test, which are Rinnies and Webers. So let us begin with the whispers test. Again, the same principle. You have to be one arm length away from the patient. You have to explain to the patient what we are going to do. जी मैं आपको कुछ अल्फाज कहूँगा, आपने मेरे पीछे दोहराने हैं, ठीक है. The whisper test, you should be saying two syllable words: cricket, hockey, football. This is what you should be saying. So the way to do a whisper test is, again, one arm length away. You shield the eyes of the patient so that they don't lip read you. You will press the opposite tragus so that no sound goes in from this side. The eyes are shielded, and you say two syllable words: cricket, hockey, football. So this is how you do a whisper test. After the whisper test comes your tuning fork examination. You take a tuning fork. The ones that we use is 512 hertz. You first have to explain the procedure to the patient. So let us begin by explaining the Rinnies. जी मैं अभी आपके कानों का सुनाई वाला एक टेस्ट करूँगा. इस दौरान मैं ये ट्यूनिंग फोर्क आपके कान के आगे पकड़ूंगा और आपके कान के पीछे रखूँगा. आपको जहाँ पे आवाज़ तेज़ सुनाई दे रही हो, आपने मुझे बताना है, ठीक है. So you take the tuning fork, you hold it by the stem, and you will strike it at the junction of upper 1/3 and lower 2/3, and it should be on a padded surface. So the one that I usually use is my elbow. Once you strike it, first you have to listen to it yourself to see whether there are any vibrations that are produced. And the way that you hold it is always parallel to the external canal. It should never be perpendicular. जी ये आवाज आपको तेज आ रही है या ये आवाज तेज है? सामने वाली आवाज तेज है. The same way you repeat the test in the opposite ear. ये आवाज तेज है या ये आवाज तेज है? सामने वाली. After doing the Rinnies test, we proceed on to do the Weber's test. Again, we explain the procedure to the patient. ये अभी मैं आपका एक और टेस्ट करूँगा जिसमें मैं ये ट्यूनिंग फोर्क आपके सर के दरमियान वाली जगह पे रखूँगा. आपने मुझे बताना है कि आप दरमियान में आवाज़ सुन रहे हैं या किसी खास कान में आपको आवाज़ सुनाई दे रही है. Again, you strike the tuning fork, you listen to it yourself, and then you place it here. कौन से कान में आवाज़ आ रही है? So there are 4 places that you can place the tuning fork in Weber's test. It can be either on the forehead, it can either be on the vertex, it can either be on the nasion, and it can even be on the upper incisors. मुंह खोलें जरा, दांत इस तरह दिखाएं. So you can also place it on the upper incisors. The one that I usually use is the forehead. This is where I place the tuning fork. For the postgrad students, another hearing test that needs to be done after Rinnies and Webers is absolute bone conduction test. Absolute bone conduction test is used to diagnose sensory neural hearing loss if your Rinnies and Webers are indicating a sensory neural deficit. So in order to do the test, first you educate the patient. जी मैं ये आला आपके कान के पीछे रखूँगा, आपको आवाज़ सुनाई देगी। जब आवाज़ सुनाई देना आपको बंद हो जाए तो आपने मुझे उंगली से इशारा करके बताना है। So when the patient signals that he is not hearing anymore, you take the same tuning fork and place it on your mastoids. If you can still hear the sound, this confirms that the patient is having sensorineural hearing loss. Now let us perform the test. Again, strike the tuning fork, listen to vibrations yourself, block the external canal and place it on the mastoid. The patient stopped hearing, so now I will block my external canal and place it on the mastoid. I can still hear the sound. If I can still hear the sound, this means that the patient is having sensorineural hearing loss. After the tuning fork comes your examination of the facial nerve. It is a very important step in the examination of the ear. In this, you will give patient commands. जी आप ऐसे करें, आंखें जोर से बंद करें, दांत दिखाएं, मुंह फुलाएं, इस तरह करें. So that is how you assess the facial nerve. After assessing the facial nerve comes your posterior rhinoscopy. Again, you have to explain the procedure to the patient that you are going to look at the back end of the nose in order to have a look at the nasopharynx and the eustachian tube opening. So for that, you will take a headlight, you will again wear it, you will take a posterior rhinoscopy mirror and you will heat it on the mirror surface. You take a lighter, gently heat it, and then you will first test it on your own hand to see whether it's too warm, and then you let the patient sense it. अच्छा देख ये गर्म नहीं है, ये ठंडा है, ठीक है. इसके ज़रिए मैंने आपकी नाक का पिछला वाला हिस्सा देखना है. अगर आपको इस दौरान कोई भी मुश्किल हो तो आपने मुझे बताना है, ठीक है. You ask them to open mouth. आप ज़रा मुंह खोलें. You will turn on the light. You ask the patient to open mouth. जी आप ज़रा अपना मुंह खोलें, ठीक है. You will take the tongue depressor in the left hand, gently depress the tongue and introduce the posterior rhinoscopy mirror gently in order to have a look at the nasopharynx or the postnasal space. You should not be touching the posterior wall as to not to elicit the gag reflex. After doing the posterior rhinoscopy, we need to do the balance assessment of the patient. For balance assessment, we need to check three systems of the patient. Number one, we need to check the eyes. Number two, we need to check the cerebellum. And number three, we need to check the vestibular system. So the thing that we are going to look for in the eyes is nystagmus. Again, we are one arm length away from the patient. We stabilize the head with one hand and we give them a fixation point. ये आप मेरी इस उंगली के नाखून को देखें, ठीक है. And we ask them to follow this target without moving his head. आपने सर नहीं हिलाना, आपने सिर्फ इसको देखना है, ठीक है. You first look for the horizontal nystagmus in the opposite direction, and then you'll be looking for vertical nystagmus. After checking for nystagmus, the next test is the fistula test. How do you do the fistula test? Again, you take up the light source, you are one arm length away, you stabilize the head, you are looking at the eyes of the patient, and you gently push the tragus in, and you are looking at the eyes of the patient. If this maneuver is able to elicit a nystagmus, this means that the fistula test is positive. We are going to assess the cerebellar functions. So the first thing that we are going to assess is this diadochokinesia. Again, you educate your patient first. आप दोनों हाथ इस तरह करें और अपने दाएं हाथ से आपने इस तरह करना है. अभी अपने बाएं हाथ से आप इस तरह करें, ठीक. The next test that we are going to do is the finger nose test. Again, first you educate your patient. ये आप अपनी नाक उंगली पे रखें इस तरह और आपने ये उंगली मेरी इस उंगली के साथ मिलानी है. चलें करें आप. Again, and you keep on changing the direction of your finger to see if there is any pass pointing. After doing the finger nose test, now we are going to assess the rhombus. For that, again, you need to first educate your patient. जी आप ज़रा खड़े हो, आप अपने जूते उतारें. The reason that we ask them to take shoes off is that the patient should be on a flat surface. And then you give them commands. अच्छा आप इस लाइन पे सीधा खड़े हो, इस लाइन पे हाथ इस तरह करें, पाँव मिलाएं, अपने पैर मिलाएं. You need to stand behind the patient so that in case they are swaying, you are able to catch them. आप सामने देखें और अपनी आंखें बंद करें. आंखें खोलें. That's it. So that's how you do the roam works. The next step that you are going to do is assess the gait of the patient. For that, first you need to do it, demonstrate it to the patient yourself. अच्छा जी आपने इस लाइन पे सीधा चलना है, आप मुझे देखें, उसके बाद आपने इस तरह आना है. आपने दोनों पैर इस तरह मिलाने हैं, हाथ साइडों पे, सामने आपने देखना है और एक पैर दूसरे पैर के सामने आना चाहिए. सामने देखते हुए आपने आना है. ठीक है, अभी आप आए, सामने देखें. You need to stand with the patient. In case if they are swaying, you are able to catch them. The last step in examination of ear is to assess for positional vertigo. For that, we will do the Dix-Hall-Pike test. Again, you explain the procedure to the patient. अच्छा जी, मैंने आपका पोजीशन वाला एक टेस्ट करना है जिसके दौरान मैंने आपने देखना है कि आपका बैलेंस का सिस्टम अच्छी तरह काम कर रहा है या नहीं. आप दोनों पैर इस तरफ ऊपर उठा लें, थोड़ा सा पीछे हो जाएं आप और आप बैठे रहें. अच्छा देखिए, मेरा हाथ तकिया है, आपने अपना सर मेरे हाथ पे रखना है और अपने आप को बिल्कुल रिलैक्स छोड़ना है. मैं आपको पीछे लेके जाऊंगा. इस दौरान आपको चक्कर आए भी तो आपने आंखें खुली रखनी है. ठीक है, आपको गर्दन की कोई तकलीफ या पीठ की कोई तकलीफ तो नहीं है. ठीक, आप सर इस तरफ मोड़ें. ठीक है, और पीछे आए आप. Your head should be tilted by 45 degrees and you should hold it in this position for at least 30 seconds to see whether there is any positional vertigo. ठीक है, अभी आप दोबारा बैठें. Now you will tilt the head to the left. Ideally, I should be coming from the left side. Tilt the head to the left and then bring them back. बहुत शुक्रिया, बहुत मेहरबानी. आप जूते पहन लें, नीचे आ जाएं. This concludes our examination of the ear. In the next video, I will be explaining in detail the interpretation of tuning fork tests, facial nerve, and the vestibular system. So please stay tuned for the next video. Thank you everyone for watching. If there are any more complex topics that you would want us to cover, please let us know in the comment section. Thank you so much.